Families Moving Forward is an emergency shelter. We provide shelter for families with children who are in the crisis of homelessness. We formed in 2016 as a result of a merger between Genesis Home and Durham Interfaith Hospitality Network. We have the capacity to serve 21 families at any given time. They can stay with us approximately 90 days. That's our goal, to move them into permanent housing. And at that point, we can work with them an additional 12 months in our aftercare program. So they have approximately at least 15 months of support from our agency. What's great is we have a new program called Healthy Homes. It was in a piloting phase in 2017, and now we have fully launched it. It is now a part of Families Moving Forward, something that we offer every family. The great thing is that thanks to DUSON, we are able to now track the effectiveness of our efforts to help bring healthier homes to Durham, starting with the families we have an opportunity to serve. So it's been amazing to see how this partnership has grown and is continually evolving. We are, at the agency, the staff, we get really bogged down and focused on doing the day-to-day work. We have great ideas, but sometimes we don't have the capacity to implement them. And so it was great when Donna approached us about the D-CHIPP program and wanting us to be one of the partners, because we could see our ideas just, being able to take root and grow. And so we were able to apply for a grant and unfortunately not get it, but it didn't stop the ideas and the work behind it. And we know that our families have so much potential, but not a lot of opportunity. And it takes community to wrap around and support. And because of DUSON's efforts and willingness to support us, we can now take one of those ideas and really start massaging it and connecting with other community partners to see how can we make this work. And one of the ideas is stackable credentials. So staying true to the health format that we've had with DUSON all along. A lot of our parents come in and they either do not have a high school equivalency or they have a high school equivalency, but they are underemployed. And in order for them to overcome poverty and homelessness permanently, we know that they need to be making a livable wage or more. And one way to do that is to get a licensure or credentials that can support them in the employment sector. And so with DUSON support through D-CHIPP, we are hoping to bring a new program that's connecting health and workforce development for our families. I think it will only grow from here. I've talked a lot about the partnership between DUSON and Families Moving Forward, but in the last month or so, I can see it growing even beyond that through D-CHIPP and Donna and you, Heather. You're so integrated in the Durham community that, every time we meet, new ideas of partnerships are brought forth, and it's so exciting to hear, we're not partnered with them yet. And my role at the agency, it's like a light bulb. Oh, yeah, we should partner with them. I can see how they can benefit Families Moving Forward in our family. So I can just see us really making Durham healthier. Especially starting with families who are often left out. We're so focused on returning them to permanent housing that sometimes we overlook basic needs. Health, that's a basic need that they should have. And if it's not taken care of, they may end up back in the homeless shelter. And so I'm really looking forward to our efforts to support our families in this specific way and bringing in new partners, because we can't do it alone. If I've learned anything over my years at Families Moving Forward, I know that we cannot do it alone, and we're better for it, to work with all the partners that we can.
Ultimately, it's the work that DUSON is already doing in our communities and the interests that the team members and the students as well as the faculty have in our population that we serve. There's clearly an interest in wanting to improve the lives of our residents, and that's paramount to us. So in terms of that input on our policies, it's really helpful. We're so excited there's the first project that's with the Blue Cross Blue Shield Foundation grant. We're excited about the partnerships that were forged to bring that forward. Without the help of DUSON D-CHIPP, Heather, and Dr. Biederman, I don't think we would have been able to get to the table on that. So that's extremely exciting. We're interested in seeing where the community-driven approach will come from, or where it will lead us to in that research. But we're especially ambitious, or should I say eager, to start the work around the evictions and the physical and mental health correlates of evictions at DHA. We're interested in that because we are really interested in the people factor. We have to do a job or a due diligence in order to serve the community, and we are interested in hearing how that work actually impacts the mental and physical well-being of our residents, and possibly pursue supportive services to prevent eviction. So we're eager to see that. That's another key point about collaboration and how these partnerships are so beneficial, because it's opening doors to opportunities that we might not have had access to. The other piece of that is the work that we actually did a couple months back in a health impact assessment in our communities. And this just was a continuation of the work that DoSign was already doing in our communities to look at the health of our residents. It's impossible to start planning a health initiative or a strategy on how to engage around health without having a benchmark, and that's what the health impact assessment did for us. We're in the process of really unpacking what will become a strategic plan around our strategic plan goal to provide healthy and sustainable homes. And as we look at that closer, I believe that the expertise of the DoSign team and D-CHIPP will be paramount in helping us really build a sound strategy to get impact and results. And so that's the first step. And then I also see DoSign and D-CHIPP as a key player in helping us to effectuate some of our goals. I'm just really grateful for the partnership or the collaboration, and that's because I've worked with university partners, and sometimes it can be a little complicated, but what I appreciate is that the extra step that DoSign took with starting D-CHIPP, and it helped to make the collaboration more accessible. And so bringing on the D-CHIPP coordinator and even having access to faculty as needed has been really helpful. And so there's never a time that I felt like I could not get something from DoSign in this partnership because of the extra step that they took.
El Centro Hispano es una organización non-profit que trabaja para fortalecer a la comunidad, crear puentes y equidad en Carolina del Norte. Nuestras áreas de enfoque es educación, salud y bienestar, desarrollo y economía, participación y abogacía. Sí, el proyecto del estudio de Ser Hispano es un proyecto con la Escuela de Enfermería de Duke, y Ser Hispano estudia, o el propósito del estudio es conocer más cómo influye en la salud, el estrés y la resiliencia. Ha sido muy buena, me encanta. Una de las cosas que más me gusta es que yo tuve que estudiar para poder hacer outreach con nuestra comunidad y poder entender qué es un estudio y para qué es el estudio. Y me encantó saber que hay un respeto a los seres humanos. Respetando si el participante explicando y tener el conocimiento de poderlos enrolar en este estudio y no engañar a alguien para obtener algo. La reacción con los participantes o nuestra comunidad ha sido muy buena. En nuestra cultura, el estrés, la resiliencia y todas las enfermedades emocionales y mentales son un tabú. Entonces, nuestra comunidad está repensando qué es estrés, qué es resiliencia, y está repensando acerca de su salud. Ahora antes era trabajar y hablar con ellos en los programas del Centro Hispano y hablarles más acerca del estudio. Y ahora ellos llaman y dicen, mi prima, mi hermana, mi comadre me dijo del estudio y yo quiero participar. Entonces es muy satisfactorio que ellos estén interesados por la experiencia que ya han tenido sus familiares con el estudio. Es bueno repensar.
Sure. Durham Housing Authority is where I work. And when I started working with Doosan, I was a ROS service coordinator. And ROS stands for Residence Opportunity Towards Self-Sufficiency. So I had the elderly and disabled demographics of the grant. And my job was to keep the seniors living and aging in place and keeping them healthy. So immediately when I found out that I had the job, I knew that a healthier person makes a healthier decision. So I had the opportunity to take the seniors to an exercise class every Thursday to a place called Care Incorporated. And I met Donna there. And of course we just clicked. And Donna said, I'm with Duke and I have a school of nurses. And I said, why don't you bring them over and let them do some blood pressure checks and health education, some clinical work. And she said, that would be a great idea. So she started coming on a Tuesday. So every Tuesday morning for 10 weeks, at least twice a year, a group of nurses would come to get that practice working with seniors and people with disabilities. So it became, it was the best day of my life. The residents love having the nurses, and when their 10 weeks are up, they come say, Ms. Briggs, when the nurse is coming back, when the nurse is coming back. So, of course, I had to tell them when they were coming back, and when they came back, they were greeted with open arms. They like having company. A lot of seniors are aging alone. Sometimes they have a lot of family coming over, and sometimes they don't. And being healthy means to socialize. So I think that the nurses help them as much as they help the nurses. There's so many projects that the nurses have engaged in, and I wanted to tell you about it. Dr. Biederman thought about once about an emergency preparedness kit. The nurses came together and they bought everyone that was a regular that comes down to their health education a kit to prepare them for the case of an emergency. And in the kit was a flashlight, a two-way radio, some water, and some food that they could use. I don't know what it's called, but in the case of an emergency, that it stays pretty fresh for a long time. And everybody got one, and I thought that was really nice. And a couple of months ago, we had I think it was when they had snow. JJ didn't have any heat and didn't have any lights. And everyone, when I came back to work, of course, the housing authority was closed. And so they came down and they said, I am so glad I had that kit. But I don't know how to work the radio and stuff like that, but you can tell on their faces that they were so glad that someone came to their aid. Oh my goodness, I don't even know what I'd do if I didn't have that partnership. A partner is a person that is always there if you need them. And I cannot think of any time that I needed something and they weren't there. And I haven't even had to ask. From the day one when I met Donna and we established a relationship, they've always been there. Anytime I know we're going to have something, Duke is always there. I just don't know what I'd do without them. And I can see why the nurses, the residents are so crazy about the nurses, because I am too. I was ill myself about 2 years ago. I went on vacation. When I came back, I was sick. And I was in hospital. And one of the student nurses that was in the class prior saw me. And she said, Miss Briggs, what are you doing here? I think some of them call me Miss Joyce. And honestly, I told them what was going on. Then all of a sudden, everyone from that class came into my room to see me in the hospital. And I guess the other nurses and doctors were like, who is this person that everybody's coming to see? But you just don't know how it warmed my heart to know that they remembered me and I connected with them. So I was very fortunate.